Hello, everyone. I'm Hsiang-Yu from Taipei Veterans General Hospital. My topic today is the neuromodulation of epilepsy network between focused ultrasound and electric stimulation. This is my disclosure of COI. And as we know that epilepsy is now considered an archetypical network disease, either interictal or ictal, they can spread and involve one or both hemispheres. And there is a growing evidence that epilepsy can affect both the structural and functional brain network properties. And for structure brain network, we can work on the DTI, but for the functional brain network studies, EEG, MEG, and functional MRI are frequently used. And cortical evopotential is a type of intracranial EEG study to investigate the brain network. It can be used to study the propagation network by giving electric stimulation within the ictal onset zone or functional neurological zone. And the CCEP is not easy to get because it can only be obtained in intracranial study of patients with epilepsy or during neurosurgery to remove brain tumor. And anyway, it is a novel way to explore the interareal connectivity in vivo in a living human brain. And this is an example of our case that after we implanted the stereo EEG, we stimulate the right occipital region, C prompt 6 and 7, and we can get the activated neural activities over the electrodes connected to the Z prompt 6 and 7 electrode. And there are several biological effects of focused ultrasound in the brain. And neuromodulation is one of them and has been demonstrated in humans. And this table summarizes the published human data of epilepsy treatment by focused ultrasound. Some use the listening effect, and the others aim to modulate the epilepsy network. And here we raise the question, will the epilepsy network investigated by CCEP and focused ultrasound be similar? And we use our phase 1 study data. In this trial, we screen patients who finished their SEEG studies. The seizure onset electrodes were chosen to be the target of focused ultrasound treatments. We excluded patients with implanted device, wound infections, recent major psychiatric problems, pregnancy, and implanted objects with metals in the focused ultrasound exposure pathway. And the treatment is guided by a navigation system. Patients don't need to be constrained in an MRI machine. The target and the trajectory are shown on the screen. The neurosurgeon holds the transducer and adjusts the position to fit the pre-planned pathway. And on the day of treatment, we shave the patient's hair and register the navigator system. The treatment parameter was listed here. The focused ultrasound treatment lasted for 10 minutes. The intracranial EEG was continuously recorded. We analyzed the intracranial EEG 10 minutes before sonication, during sonication, and 10 minutes after sonication. In the target electrode, low frequency power reduced after treatment compared to before treatment, while in the non-target electrode, there was no significant changes. And this is a summary of the 6 cases regarding the power change. There is a trend of increased power during sonication and reduced power after treatment compared to baseline. And To answer our questions, we choose case 2 and 4 in the phase 1 clinical trial because they have both CCEP data and they did not undergo resection surgery before the treatment. And CCEP in these two cases, we use anicillate cortical stimulators, and we choose electrode of seizure onset zone to be stimulated. And this is our treatment stimulation parameters, and low frequency 1 Hertz and lasting for 20 to 40 seconds. And intracranial EEG study, either by subdural grid or stereo EEG, had problems in sampling. It is not possible to implant the electrode all over the brain. The neural activity not sampled by the SEEG could be estimated by the intracranial source modeling. And this is how we process the intracranial source modeling. Here, like this. And we estimate the whole brain activity by the implanted SEEG. And the method has been published last year. And the result for the case 2, it is a frontal lobe epilepsy. The light blue spot is where we define a seizure onset zone. We stimulate here by focused ultrasound and electric stimulation. And this is where we stimulate. And for the focused ultrasound, let's see the around 6 Hertz. And we stimulate here and we got an activation over the left temporal regions. And for the CCEP stimulation, here, close to the stimulation, we got a activation, a widespread activation, but we can see the temporal region and anterior temporal region, which are remote from our stimulation, got activation here. And the regions are quite similar to the activation regions by focused ultrasound. And this is the second case. We got a medial temporal seizure onset zone here, and we stimulate here. For the focused ultrasound stimulation, we stimulate the hippocampus here, and we got the activation over the dorsal lateral frontal prefrontal cortex. And for the CCEP similar area, when we stimulate the hippocampus, we got an activation over the dorsolateral prefrontal cortex. And the summary of these two cases, which are quite preliminary, and the stimulation of frontal lobe, we got an activation of mid-temporal regions by focused ultrasound. And in CCEP, we can see the activation of the anterior and the mid-temporal regions. And when we stimulate the hippocampus in focused ultrasound, the activation of dorsolateral prefrontal cortex can be seen. And for CCEP, that is the activation of dorsolateral prefrontal cortex. And we can assume that a remote activation and the activation of brain activity by focused ultrasound treatment could be a potential novel method to investigate the epileptic network. And thank you for your listening.